Good afternoon, everyone. My name is Teresa Lawrence, and I am the CEO of Delta Administrative Services and the owner of Delta Personnel, and it's my wonderful honor to welcome you today. Everyone is on the inaugural call of Dialing with Delta, and today's conversation will center on the controversial start of the school year. Considering some of the challenges from multiple perspectives, our intention is to provide unbiased guidance, not to initiate any arguments, so let's just keep it civil, okay? So let me introduce you to our wonderful panelists who are generously taking time out of their busy schedule today to be with us. Gay Knott from St. Margaret Mary, I knew that one good. From St. Margaret Mary will share her school's contingency plan and changes with Phase 3 in Slidell, Louisiana. Then Nick Joshi and Torben Madson from the PEO law firm in Florida will clarify some of the required employer accommodations according to FMLA, ADA, and FFCRA. Lots of acronyms in there. Following that, Franklin Campbell will join us to speak to operational efficiencies with so many involving technologies that have emerged this year due to COVID-19. Next, we'll have pharmacy manager Brian Prince, and he will update us on the CDC guidelines for this year's flu vaccine and debunk some of the common misconceptions that people have. And last but not least, we will have Jamie Dyche, and she will be discussing mental health as a school counselor in Texas during this pandemic. And without further ado, let's move up to the first panelist, and that's going to be Gay. Let's start with you.
Okay.
How are you doing, darling?
Doing great.
Doing great. I'm anxious
right now.
I'm anxious to hear all the good things that are happening over there. With each school district given the opportunity to decide the best learning format, there's so much more risk involved when you have to depend on a child to follow rules.
Mm-hmm.
Talk to us about St. Margaret Mary's contingency plan and what has your school done to create a safer learning environment for our local students, and how has this changed with Phase 3?
Well, we'll start at the very beginning. We knew we wanted to be back in school face-to-face because we know that's the best learning for children. Now, we're a smaller school, about 350 students. We are elementary, pre-K through 7. And so some of the things that we did, first of all, was meet as an administrative team and then as teachers and decided we wanted to go. We put out a survey to the parents. More than 87% said they wanted to be back in school on the regular start date of August 6th, and over 85% of them said, we don't care about buses. And so everybody had to drive and pick up their child. Some of the changes were we reduced our class size. You can't have more than 25 in a class or in a space. And so the teacher would be 25 and 24 students, but we're not quite even in that in any homeroom right now. And the little ones are 20 students and below. We had to take all the extraneous stuff out of the classrooms, and we had to spread out the desk wall to wall, front to back, as much as possible. The students have to face forward. They have to wear masks to the greatest extent possible. Must wear masks 3rd grade and above, but I go into classrooms often and I see my 1st and 2nd graders also wearing masks.
That is amazing. So listen, as a representative from the Jefferson Parish School was unable to participate today, and she shared with us that overall feedback from parents has been positive and that they're happy that their kids will have structure and socialization with the return to classes. And from what you're sharing with me, you're having the same experience, I'm assuming.
We're having a great experience. You would not believe the smiles on the faces of the kids when they get out the car. Mm-hmm. They're so happy to be in school, and the parents are as well. We have a greeting line. We have 6 of us that open the door, take temps, and greet everybody in the morning. and they go line up social distancing until they go to their classrooms. And when they get off the bus, they have to go in the gym, get their temperature taken, and then go to their place. And they all have their little mask on, and they're all happy. And I mean, children are resilient. And if you say, this is what we need to keep the school open for you to see your friends and to see your teachers, they're going to do it. Now, teachers, of course, have their visors for when they're in front of the class. And of course, they wear their mask if they have to rotate around the classroom. So
how are you communicating this to the parents?
Oh, well,
I mean, is there a daily update?
Well, we do update as necessary, but we have a weekly newsletter that went throughout the school. Even when we weren't in school, we updated them on our progress every step of the way. And then, oops, Jamie's in and out. And we send out a newsletter every week, and our principal sends out principal bullets as needed.
So you kept them engaged. That's beautiful.
Oh, yes.
That is beautiful. So I'm going to ask, you know, that's engaging from both parties. That's the solution. So getting them, everybody on board with that. Jamie, what will you say are the biggest school-related stressors for kids right now, as you shared with us as a counselor in Plano, Texas? How is that mental health coming along with the children?
Sure. Can you hear me?
Yes, absolutely. Thank you for joining.
Sorry about all the connections. Actually, one thing that happened today was the district lost internet, I guess, due to storms. And so it's been an interesting, adaptation. But in terms of stressors, for kiddos, what I've noticed, particularly in the students who are still remote learning, anxiety has been increased. Now, as you know, it was mentioned earlier from another panelist, the kiddos who are coming to school are adapting very, very well. They're doing their masks, they're staying socially distant. Of course, there's still, that desire to interact and to be social and to show affection that they're not able to do. But right now, about half of our school is still remote learning. Due to parent choice, and those kiddos are struggling with some anxiety. Not all, but some have asked me to help with them and help to try to cope and overcome that anxiety just from a new environment and new circumstances.
Yeah, because you have both the parents and the students. So what are you doing to cope with that? What are you providing to both parties?
Yeah, so parents are being really, really great and very good at correspondence. We've been emailing and phone calls and all that fun stuff. I've provided a lot of just digital resources. There are some really amazing books. I mean, both at the elementary level and then the secondary level as well. I'm elementary, but there are some really good books that parents can read with their children regarding COVID-19. And I think one is even titled Why I Can't Go to School Today. So just being open and honest about, the safety precautions that are in hand. And I try to tell parents that, yeah, as it was mentioned earlier, kids are very resilient. It's proven scientifically that they can actually overcome traumatic experiences in their brain with different adult relationships. So as long as parents and teachers are there for the students and really giving them what they need in terms of resources or honesty or just communication, it'll make a really
I think I might have lost you, Jamie.
Yeah.
I think you are.
no.
You're there?
Yes.
Yes, I lost you, darling. I do want to.
Oh no.
Yes, I did lose you. But I like that you have tools and you're providing to both parents, and it is both of them at this. They're both holding hands together. So having someone like you to step up and provide them with some, knowledge and sharing, just common sharing. I think that sometimes commonly sharing is key. Erin, do we have any questions thus far? Because I have plenty.
No, we have no questions from the participants yet.
Jamie, I know you're short on time with us, darling. Is there anything that you could, just a bit of any suggestions for our audience that they can look into real quickly?
Yeah, I might have broken up when I was saying the books, but there are a lot of different online resources. Yeah, there are a lot of different resources. Just reach out to your schools. I know myself, I've been contacted several times with parents, and I do not mind at all helping. Other than that, just grant your student, yourself, and your teachers some grace. And we're in this together. We're learning one day at a time, 1 hour at a time, rather. And just go from there. There's bumps going to be in the road. That's inevitable. But the schools and the school staff really are there for the families. So please don't hesitate to reach out to them.
Thank you so much, Jamie. I appreciate all this time, and I appreciate you sharing this with us. And that there is light at the end of the tunnel. There is light at the end of the tunnel. I'm going to change things a little bit, and I'm going to go to Nick and Torben. What should employers do when one of their workers says that they're being tested for COVID-19 due to close contact with a positive case at a child's school? And are you allowed to ask employees to share the test results? Either one of you guys are good at this, or jump in.
I'll take that question. Thank you for that, Francesca, or Teresa, actually. I would say this, yes, in this context, okay, the Department of Labor, U.S. Department of Labor has made a great deal of exception to otherwise what would be the law in the country with what you can or cannot ask an employee. So typically under the Americans with Disabilities Act and the FMLA, there's certain things that you cannot ask at certain points of the employment relationship. But given that we're in a pandemic, and this is something that is quite obviously unique and very hard on everyone, the Department of Labor has made significant exceptions and has included flexibility in an employer's ability to ask those sorts of questions of employees. So if you learn that an employee has come across anyone, family circle or otherwise, who may have COVID or is showing symptoms, you could, on a one-on-one, private setting, bring them into your office and ask those sorts of questions, because it's important for you to know, are you then inviting someone into your workplace who could then become a spreader? So it is allowed by the ADA, and it is a sort of an exception to the rule. However, use, good sense and, good judgment in terms of how you ask those questions, and try to do it in as private a realm as possible. Okay. Probably another question that will come out of that is, what happens if you find out that individual has been around someone, maybe even in fact that individual is exhibiting symptoms or not feeling well, right? And what would you do under that particular circumstance? The same laws under the ADA and the Department of Labor guidance that has been issued and updated multiple times in the last 3-4 months allows the employer flexibility to send those employees home and not require them to stay working at the facility. If there's a capability that that employee could work from home, telecommute or otherwise, then that would be an option. If not, and they are showing symptoms, then the balance of the equation favors the employer sending that employee home as opposed to keeping them in the workplace.
And one other thing on that, Nick, very well said. I explained that quite clearly. Remember that you as an employer, that you have certain liabilities for your workforce. So if you know that a worker is there who is sick or is may be sick, and you expose your other employees to it, you could be opening the door to other liabilities. So you have to be very attuned to the wise and sage advice that Nick Joshi, who unfortunately on this on his photo there says it's Francesca, has given us. So that's Nick, not Francesca. Not that there's anything wrong with that.
Yeah, and I echo what Torben said. In this environment, you have to look at the entire workforce, and there's a defense, an affirmative defense to any case involving a potential ADA violation. which would be called a direct threat defense. So even if you are knowingly violating the ADA, if you can say there's a direct threat and we have to address this, you would avoid liability under that law. And the Department of Labor guidance to date is indicating that obviously a pandemic situation like this, if someone's in the workplace, that is a direct threat. So they're giving you as the employer a lot more flexibility to handle that on a case-by-case basis. So that's a good thing.
We can't hear you, Teresa, you're muted.
Thank you. Thank you. Listen, so saying what you're saying, which employees are eligible for FMLA or and FFCRA?
Yeah, so for those of you who may not know, the FMLA, obviously I think everyone knows, is the Family Medical Leave Act. The FFCRA is the federal law that was passed effective April 1st in light of COVID. That was basically a short-term modification of the FMLA. And it's interesting how how this came about, but FMLA applies to any employer who has at least 50 or more employees within a 75-mile radius, all right? The FFCRA, on the other hand, however, applies to employers who have fewer than 500 employees, okay? So if you happen to be a large operation greater than 500 employees, you're not covered by that law. You don't have these obligations. It's the smaller mid-sized businesses with fewer than 500 employees who do have these obligations. And any employee, other than a very limited exemption for healthcare providers, any other employee is entitled to take this leave, up to 80 hours of paid leave if you are sick or you're caring for someone who is actually sick or potentially subject to a quarantine order and can't go back to work. That's up to 80 hours of paid leave through December 31st, 2020. If you're in one other bucket, you're caring for a child at home, and I know we're talking a lot about school today, you're caring for a child who is not back in school and you're with that child, you're entitled not only to those 80 hours for the first 2 weeks, but then an additional 10 weeks at 2/3 pay, not full pay, but 2/3 pay. The first 80 hours is at full pay. The next 10 weeks, which is of the total 12-week allotment, would be at 2/3 pay, but it's capped at a certain dollar number by statute. But otherwise, that is an entitlement to allow parents who have no choice but to be at home with a child who cannot be alone by themselves and they're doing homeschool.
So going back to that conversation about if my child is exposed, you know, and in that vein of conversation, if a remote employee taking care of the child at home with COVID-19 is asymptomatic, are employers allowed to ask him or her to continue working?
If the employee himself or herself is asymptomatic and they just believe they've been around someone who may have symptoms.
Like the child that, yeah. Mm-hmm.
Yeah, and in that case, again, your first line of defense is to let them stay home and maybe go get tested to confirm they don't have it before you allow them to come to work again, because the burden is if you believe that they've been in contact and you still allow them to come back into the workplace and then something happens within the workplace, we as the employer then have that obligation to keep our workplace safe, as Torben alluded to earlier, and we would then have not done that here. And there are OSHA requirements with respect to maintaining a safe working environment, even with COVID. Of course, there's the ADA and FMLA. So there's a number of different laws that impact the workplace that we have to be mindful of. So the safest route is to ask that person to just stay home, go get tested, and then allow them to come back once they're clear.
Come back.
And Teresa, there are, again, on that eligibility, small companies of under 50 employees can claim an exemption, but it's risky. It's very risky. And I know that some companies have talked about doing that, really small mom and pop shops, 2- and 3-man companies. But again, you better dot your I's and cross your T's at the end, right, Nick?
Yeah, absolutely. And Torben's right. There is a exemption for what's called an undue hardship or excess hardship on the business, but you do have to have pretty solid documentation as to why you can't comply with this, because the emphasis behind the law is to help provide some help to the employees so the business can still operate. But if you can't do that, or if in fact you're shut down because you just can't operate, then you do not have the paid leave obligation at that point.
So how will teleworking during this pandemic set precedent in the future when an employee seeks telework as an accommodation to ADA, Torben?
So, and we'll do a little bit of this dance. So you get into EEOC, and one of the concerns is after this settles down, and the answer, first step is it's very complicated. I think that the courts are going to look at this, they're going to look at the full consideration and realize that what you're doing now is an immediate response to a crisis. This is not a normal work day, a normal work week. It's a response to a crisis. So I think the courts and the government are going to look to that as the first lead-in. You're simply responding to that. So companies changing their jobs, allowing people to accommodate, that's an accommodation of a crisis. Eventually, though, there may be some employees that try to claim that, listen, their job has not changed significantly and they're still doing their regular job. There may be someone that pushes that to the EEOC level. I don't see that as being a probability. I think this is going to be still viewed primarily as a critical mass issue in a crisis. So I don't see the significant precedents, but that's me, Nick. You're the wise man over there with the cool name, so.
No, I mean, I think Torben's correct on this. I think the way the law looks at issues like this is an employer can always make determinations based upon the facts and circumstances at hand. You know, the employers always have that discretion. Does that mean that an employee later on could say, hey, you know, you accommodated someone in my situation due to COVID and they were still productive. Why can't I stay at home to do whatever? Certainly an employee can raise that as an argument to say I should similarly be accommodated. But you as the employer have the right to make the call in terms of what you want for your workforce and your organization, where you want them to do the work and how you achieved. So ultimately, I think the courts and the Department of Labor will weigh on the side of the business in that context.
I think employers sometimes lose sight of that because we don't know, this is so new. So we appreciate all this information, and we're going to come back with you guys for a couple more questions. But I want to see what Franklin, you there? How are you?
I'm great. How are you?
Good to see you. Good to see you, my friend.
Likewise. Thank you so much for having me.
Virtual hugs.
Thank you.
You have some excellent experience in healthcare operations and business strategy. One of the best in the class. Can you share with us some of the observations you've made regarding the introduction of technologies, both in terms of telehealth and telework?
Sure.
Virtual.
Sure. So, you know, I think that on that telehealth side, I think as an industry, we are very fortunate that technology is somewhat mature and has become somewhat accepted. You know, across all kinds of payers and all kinds of populations. I think, as everybody probably knows, CMS, which is Medicare and Medicaid, allowed for telehealth to be reimbursed immediately upon the declaration of a national emergency, and all of the other payers followed suit. Seema Verma, who is the administrator of CMS, has indicated that they will not reverse that rule. And so telehealth is here to stay. And I can tell you, as I talk to my clients and others on the provider side, they're amazed at how much more efficient and effective it makes their providers and how much more their patients honestly like it, right? You don't have to get in your car. You don't have to drive 20 minutes out to your doctor's office. You don't have to wait in their waiting room. If they're running late, you know, you can do stuff around the house. You know, you get your doctor's attention, and you know, and so both patients and providers alike really like it. There also is a lot of technology that can be connected to telehealth from home. So, for example, Oxner has this kit where I could be taking my own blood pressure, my own heart rate, you know, all those kinds of vitals, as well as other things. And my doctor would be looking at that real time. Additionally, you know, with the way that labs have now kind of restructured the way that they are, what's happened is this has created ways for providers to get lab work, blood work in advance, or urine tests in advance of your visit, and then actually review those tests during your visit, rather than the way that it used to happen 4 months ago, where you would go and they'd order all those tests and then you'd have to, you know, they'd get to you afterwards. So from my perspective, all of this is good. It's going to save us money. People like it better. And, you know, we'll see. The proof is going to be in the pudding, but I think it's going to be better care at the end of the day.
But during the transition of employees or students to this new environment, can present several unforeseen challenges, as you know. Experience it. We're hearing from everyone how challenging it is to chart path, clear path in this pandemic. In your opinion, how can employers or schools best leverage budget and emergency funding to update companies' infrastructure with advancing technology? So all this changing, what can they reach out? What could they?
Yeah. So, you know, I am not here to represent Tulane, but I know what Tulane has done, and I know what my really forward-thinking clients have done. And that word emergency funding that you brought up is not part of their lexicon as it relates to this, Teresa. So they view as investments in telehealth or updating the classrooms or whatever it is that they need to do as just an investment in infrastructure, just like they would replace the roof or get new technology elsewhere or get new equipment or whatever it is. And so there was lots of shifting of those capital budgets into these arenas. But I think that the organizations that are really going to succeed are those that see this not as, oh, this is an emergency that we need to take care of right now, but rather as this is a core competency that we are going to need to have forever. Even, you know, if there's no pandemic, you know, 6 months from now, goodness knows what's going to happen 2 years from now. And if we don't have it then, you know, we're screwed, and we don't have an excuse. And so, you know, I think that organizations really need to think about this as just a regular investment that they would make on a regular year. And this is what's important this year.
It's a sustainable choice. And I think that it's very, very commendable. So let me ask you this. When a vaccine is issued for COVID-19, it will be interesting, new normal. However, after this country's history with anti-vax protesters, and I'm smiling as I say this, how should employers incorporate immunization in their company policies in order to move forward and keep their workforce safe?
Sure, that's a great question. So first of all, there are certain organizations where it is a condition of work. So, you know, if you work in a hospital, you have to be vaccinated, period. And there are no exceptions. I mean, even if you have a religious exception, it doesn't work. The only one would be a healthcare exception, and the medical director who's in charge of employee health would have to clear that employee to be working in the healthcare environment. So, you know, hospitals, you have to be vaccinated, period. Not a choice. Among other employers, you know, I think it depends on the type of employer you are and the type of work that you do. And, you know, I think most employers where employees can, you know, telecommute, they are encouraging that right now. I know that there are certain large ones that are also encouraging them to come back to work. You know, the policy that I would guess would emerge would be, if you're not willing to get vaccinated, you're going to telecommute. You know, or we're going to have some sort of strict way to get you in a bubble so that you don't, you know, infect others in the workplace. Because even, you know, we all get a flu vaccination every year, right? And lots of us still get the flu. So we're not quite sure how well this vaccine is going to work.
This is true.
And I think that we need to create an environment, right, where we are responsible, you know, to our coworkers and to our communities. And if we are not comfortable with a vaccine for religious or health or other reasons, that's fine. But our responsibility will then be to, you know, to distance and or isolate ourselves, you know, to the best extent possible, so that we aren't possibly spreading.
Yeah, and it's that well-being, maintaining that focus.
That's right. One more thing I will say, and I've got some clients on the business side, not on the healthcare side, that are hoping that this will happen. If we remember, over the past couple of years, we had, maybe it was 2 years ago, we had a mumps outbreak among children.
I remember that.
There were a number of municipalities, Seattle and New York being the most prominent, where they mandated it and got rid of all of the exceptions, period, unless a doctor said that the kid would die, basically, if he or she got the vaccination. And they were huge fines. I mean, like the first one was a couple $100s, and then it went up to thousands. And, you know, I know in New York, especially, and in Brooklyn, this was very controversial among the Orthodox Jewish community. And they just took the fines. But I know a lot of employers are hoping that municipalities may step up and just make it a requirement, and that takes the employers off the hook, right?
And that's easier, you know, to having the two lawyers in the room here, you know, having those policies instated in their you know, company policy.
That's
can be
right.
challenging sometimes, and I think that sometimes during this period we don't have a beginning and an end. So it's kind of hard, you know, up until pandemic ends. You know, it's a very hard one. But something like this, it's sustainable. It's for the well-being. It's a continuous effort of the community to bring health as a number one.
That's exactly. Yeah.
That's, you know, and I think
right.
at the end of the day, that's what they're looking for. Thank you, Franklin. Thank you.
Can I have something there?
My pleasure.
Yeah, absolutely.
Yeah, and I would say from the employer's perspective, as a private employer, you absolutely have the right to put in a policy requiring vaccines.
Very good point.
That there's nothing that's going to prohibit that. Like you alluded to, there are, you know, religious exemptions, or some states have philosophical exemption opportunities, but even the religious exemption under federal employment law is de minimis. I mean, if you say safety is more important than whether or not whatever your religious issue is, then you can still mandate that. It's not they can't overcome it necessarily.
That's correct.
Place. And so I think the employer, depending on the ethos of that business or that organization, can look at this as an opportunity to say, this is who we are, and this is what we like to do with respect to our workforce and our community. And it can become a competitive advantage because there may be other businesses that may not go that route. And they may think that's a competitive advantage, but whatever the case may be, this is an opportunity too that you feel, you know, we want to take the lead on this issue. We don't want to fall behind, because I do think you're right, Franklin. I think this is
great points.
You know, this is a sustainable thing, you know, for the future.
You know,
yeah,
and
great points.
That and that's, you know, it's funny because sometimes we forget that we are the owners not only of the companies but the environment around us. You know, we're taking ownership of that, and that's a, you know, that's a step I think sometimes we fail to see. And talking about taking care of the community, I'm gonna ask Brian, and you know, this is a touchy question because of, you know, but tell us, why is it important for flu vaccines to be given during the COVID-19 pandemic, and what are the common misconceptions? Because, you know, that's the buzzword out there. Do I do it? Do I not do it? What do you say?
Well, I'd say as far as flu vaccines relating to during the COVID pandemic that we have going on, basically preventing yourself from catching the flu or something of that nature is going to rule out a lot of false people, or people with false, not necessarily positives from tests, but people that think, oh gosh, I have, you know, COVID symptoms, because they could present pretty similarly early on. So I think that staying as healthy as possible and preventing, you know, people from having the flu is going to be important during this, you know, during times of COVID. For that reason, is that we're keeping more people healthy. You could actually catch both at the same time, and that would probably, we haven't run into that yet that I'm aware of, but it's something that could happen. I think the flu, I mean, the CDC recommends everyone over 6 months get the flu vaccine. So I don't believe that it's necessarily something that we should question. I think that most people should get the flu vaccine. You know, I work in a retail environment providing immunizations of all types, but a lot of misconceptions are, oh, one time I got the flu, or I have a friend who got the flu after they got the flu shot. Well, you know, it's not a magic bullet. We don't have that, maybe in the future, but for now, people who get the flu shot are more protected against the strains that are involved in, you know, that year's particular flu shot. Usually we administer quadrivalent, which protects you against 4 strains. but it's still not a magic bullet. You can get the flu, and it also takes a couple of weeks for your body to run through the course of producing antibodies and developing that immunity. So you can't just go out directly after your flu shot and put on your coat, because you're not immune yet.
And the anxiety, behind all of that. I think you can probably understand. And I'll be curious, I'm probably going to follow up with you to see later on down the line in comparison to this year and last year, and how is that, is it higher, the numbers coming in, or lower? So I'll be curious too. Yeah, for the flu shots, yeah.
Well, I think this year we're going to have higher numbers. Anticipated more people are going to want the vaccine this year, but I'm hoping actual flu cases will be lower this year because we already have pre-existing precautions and measures in place for COVID, such as people wearing a mask, people socially distancing. So while I think more people will choose to get the vaccine and be protected, I'm hoping the overall flu numbers and deaths from flu are a lot lower this year than in previous years.
Yeah. So let me ask you this. Will there be changes in how and when and where flu vaccines is given this fall and winter? And what's recommended for the safety of the public? What's the timeline?
We've started already where I work, immunizing. We actually got ours at the beginning of September. A lot of people say wait till around October. It kind of depends, every year I see shortages, especially in the high dose, which is for people who are over 65 years of age. So that being said, we're recommending that people come in a little earlier this year, just so they can get it taken care of and not have to worry about it when, we're in winter and we have our either, depending on how you look at it, a surge in flu or COVID for that matter.
Can I say something? We have a pharmacist coming into our school next week to give the flu shot to our employees. We do this every year because we're teachers. We're around everything. Yeah. So we're doing it next week. So.
No, I feel like pharmacies probably become the major provider of definitely flu immunizations, if not approaching total immunizations for the country. I feel like pharmacists have really stepped into that role and just are able to provide it with ease of access, because you can walk into most pharmacies and get a flu shot and be out in 15 minutes, or for that matter any vaccine that you need. We offer shingles, hepatitis, HPV. We offer, there's probably 20 vaccines that we offer in my pharmacy.
So let me ask you this. Let's say, like I asked Franklin, if in fact we would have a vaccine, and I don't want to call it a magic vaccine like you share with the flu shots, it may reduce it or the exposure and so forth. How would you manage the response? So how are you? I'm just speaking to you directly, but how are you going to manage the demand? How do you see that process?
Well, I think as far as personnel is concerned and the ability to administer the shots is going to be less inhibitive than the amount of flu or the amount of new vaccines available on market. I don't think that the initial supply will be able to keep up with the demand. So I see them structuring it to where there's high risk patients should be prioritized in receiving the vaccine. At least, I don't work for the CDC, but my personal opinion is that prioritizing who gets the vaccine, maybe elderly patients first, and then work our way down, because I think that supply and demand is going to come into play here significantly. You think of the number of people we have in the country. There's shortages for flu shots, and we have that every year. So when it comes to a COVID vaccine, I definitely see there being some issues with distribution.
And
Teresa, if I can, this is Franklin.
Can
you hear me?
Yes.
Yep.
Yes.
Okay. If we think back to the distribution of PPE, and that was, forgive me, but it was a little disastrous. I am certain that there will be much more coordination among the applicable agencies of the federal government and the state's Department of Health to prioritize distribution in a very deliberate manner, regardless of who wins the election and how that happens. I just can't imagine that would not be somewhat prescriptive, given the mess that came with all the states competing for PPE and the government, federal government stepping in, and I mean it just was a mess. So my guess is that because that's so recent, because it's the same pandemic, we're going to fix it. And by fix it, I mean we're going to do it in a meaningful way. I do think, actually, I know. I mean, it's not like tomorrow or whenever, whenever it's available. It's not like we're going to have 300 million doses and we can vaccinate the entire country. So it'll go to first responders, it'll go to those who are elderly and infirm. I mean, I can, even within organizations, working in a health care organization, it goes to those who are in front of patients first. And then it goes to those who are kind of ancillary to them, housekeepers and others second, and those of us that sit in our offices and and don't do a lot, it comes to us last. So it's all about where the need and the risk is at most. Yeah.
And I imagine also having some guidelines in place, like I'm listening to Gay, bringing in the vaccine to her instead of having to make appointments and follow up to see if it was done. She brings them in and they do it right then and there. I'm hoping, and I guess I'm hoping, Franklin, for the same thing you are, which is a more strategic distribution of this. And Brian, I'm sorry.
Well, and look, you're right. We've got all these COVID testing centers, right, that are promulgated by municipalities, and I mean that's the perfect place. If you can't just transition and have nurses in the workplace. Or Teresa, for your employees, this would make a lot of sense, right? When they're eligible, they just go walk in to, or drive through wherever it is. And we already have it set up with the testing sites. So, that's a natural place to give the vaccination.
That would be a flow. Yeah, absolutely.
A lot of pharmacies are actually providing testing now too. I know that the company that I work for, here on their behalf.
That's right.
They had one company that they let go, but a new.
That's right. I'm gonna have to sign off for a minute, but I'll be back.
Okay, Franklin. So say it again, Brian. You're saying that.
I was just saying that that's the COVID testing is something that a lot of pharmacies are going to start to provide as well. So I know that most of the stores in the Jefferson and New Orleans parishes will within the next month or two provide COVID testing to the public.
Yeah. Any of you guys having that in your location? I know you guys have. I have people from Florida, and I know Jamie jumped off. She was from Plano. But any testing nearby? You guys have seen that a lot more. I have seen a search of more available than we were more on the military way. I think it's more a lot of clinics have going satellite, if you will. I don't know and so I started thinking about the legalities behind that, and is that affecting outcomes, and how do you rigidly follow that this was safely done and things like that. And I know it complicates matter when the masses are in demand. So
I mean, I could say from some of anecdotal from the client calls I get from different types of employers in different parts of Florida, there were state opened testing sites, and then there were private testing sites, and some were rapid tests and some were not, and some were private clinic tests that were given. And so the results and the timing of the results were all over the place. And so that also impacted how quickly an employer could react. And there was also a question of reliability. A lot of folks were questioning the validity or reliability of some of the testing, whether it be at the state mandated site or some other site. And then they're comparing things and people start talking. And so again, in order to help smooth that out, we were ending up having to recommend you might have to have them retested someplace else. So again, these are the sorts of things that when there wasn't a certain prescriptive approach to this, it caused a lot more questions from people, right, in terms of reliability. And I think that's to your point that we were hearing about earlier.
And by the way, and Nick's right, another twist there again is the reliability of the testing. When you have to have employees go back and be retested because questions have arisen regarding the test. And we've seen cases where we've had people test positive, but have later tested negative from the exact same time period. So, which complicates things even more for people running a school or a business.
Yeah.
Absolutely.
You're muted again, Teresa.
No, it doesn't. I didn't touch it. This has been so terrific, and I could go on asking Gay a lot of questions about the school and the students, and you guys giving us some guidance about the right thing to do for employees and employers. Having a good health, sustainable community is of utmost interest to all of us. Brian, thank you for sharing, and I hope that other facilities as yours provides the same thing. I hope it catches up and it goes through it, because like I said, the validity behind it, it's a name brand that goes with it sometimes. I am delighted to have met all of y'all. I cannot thank you enough for this time. Aaron, do you have anything to say to us?
There was one question that came about when Nick was speaking, inquiring as to what the healthcare worker exemption is.
Yeah, good question. I'm glad you brought that back up, Aaron. I did have a note to bring that up. So up until September 16th, according to the FFCRA requirements, a healthcare provider was allowed to make exempt from that paid 80-hour leave obligation anyone who essentially worked for a healthcare provider, even if that person is just a stenographer in the back and doesn't touch a patient, they could still be denied the 80 hours. As of September 16th, the U.S. Department of Labor updated that and restricted the definition of that exemption because the federal court struck it down, saying that it was overly broad. And so the U.S. Department of Labor had to go back and refine that definition and exemption to say only those who actually touch a patient or have the capability of serving a patient with a healthcare need can be deemed exempt by that healthcare provider and not be entitled to the 80-hour paid leave.
And real quick, and we're wrapping up. First, Delta, thank you for putting this together. This wasn't easy, herding all of us cats into one room, but I think it was outstanding. It's a really wonderful value-added benefit you provide to your customers and clients. Real quickly, and Nick, you might have something just as a kind of a fair warning. Some of you may have heard the president had issued an executive order allowing these Social Security deferrals. Again, I'm offering no legal advice, nor is Nick, but understand that if that happens, that there will be a collection period in 2021, and that if your employee does not return and pay that in, then you as the employer will have liabilities for it. So that's one of the big concerns out there as well. Please exercise caution when considering that. That's one of the things I would suggest we watch out for.
It's a good question, good point, Torben. Real quick, the IRS did issue guidance on that a couple weeks ago, but it's not a mandate. A lot of employers aren't aware of that. They think they have a voice, but you can advise your employees that, look, if we can take it out, but as of now, we're going to have to pay it all back, plus your current taxes in the first quarter of 2021, and that might come as a shock to some people. So, probably better to have some sort of conversation.
Or you can opt out, I think, is still the option. So that's also yeah.
You have a choice. Aaron, any other questions?
No, that was one moment. So if my parents used to watch my child after school, but is no longer able to do so due to COVID-19 concerns, am I entitled to FFCRA leave?
Yes, if you otherwise meet the technical requirements that make you qualified for that leave, yes, you are if your normal care, childcare is not available. So if you have an option to say, well, you have your aunt down the street and that hasn't been your normal approach, then the conservative guidance is that the employee would be entitled to that FFCRA leave, because otherwise what could happen is you have that employee suing you for interference with that leave right. And that is, interference is a line available to employees to sue under if they feel that their rights were withheld from them. So yes, it's probably better to, if they don't have their same opportunity, to then move on. Now, real quick, if those opportunities are still available to them, but they're just choosing to stay home, then you don't have to provide paid leave. But you do need to do some due diligence on that and document that case so that you can justify your denial.
Thank you.
Okay.
Thank you. Gay, I know you had zero COVID.
Zero.
I applaud you, my friend. Lots of great work.
You're due diligent. I mean, if there is a secondary contact or a first contact, we do require the children to be quarantined for the 10 plus 14 days. And the teachers do provide materials and Zoom with them and keep in contact with them. But, oh no, we're very diligent about making the kids stay home if they have secondary or primary contact.
Beautiful, beautiful. Brian, thank you. Sorry.
I just have to do it.
No, and I said, you know, and I'm thinking about Brian and you connecting to come visit you if you have a second round of vaccines that, you know, you guys will connect. I'm going to wrap it up here. Like I said, I'm delighted to have been part of this wonderful conversation. You guys have brought great light into a lot of matters that people are concerned about. I cannot thank you enough for your time, and I hope you have a great rest of the afternoon. Thank you so much, everyone. Thank you for joining us.
Thank you for having us.
Thank you, Brian. Thank you so much.
Okay.
Goodbye.